Hi, welcome back to Balanced Health. On today's episode, we're discussing the importance of sleep with Dr. Andrew Mouton. But before we continue our discussion, let's take a look at this week's Debunking the Myth, Joe, and it's regarding a sleep disorder.
Very much so. We've actually touched on it a little bit. It bears repeating, though. The myth is that only middle-aged obese men have sleep apnea. And of course, when we debunk that myth, we find that it's possible for anyone
even
to have sleep apnea.
Absolutely,
Wow.
absolutely.
So children,
because,
little old ladies.
Yeah, we thought, and I always thought too, and my husband is not obese by any means, but he kind of has, chubby cheeks, and don't tell him I said that. And so I thought it really did have something to do with being overweight in some way, but it doesn't.
Increasing weight is the greatest risk factor for developing sleep apnea, but there are plenty of people who have sleep apnea who are not the least bit overweight.
And one thing I read recently is how many of these very developed athletes are experiencing sleep apnea. For some reason, seemingly higher in African Americans, and they have the big muscular necks and the big chest, and they lay on their side, and apparently that.
Well, Reggie White, God bless him. I mean, he was a friend, and he died.
The risk of sleep apnea is statistically significant in men anytime the collar size hits 17.5 inches. So, if you look at most linemen.
Right.
It's more than 17.5 inches.
Well, we have a little apparatus here, which my husband, it's a love-hate relationship with these things, because having one of these CPAP, what does that stand for anyway?
Continuous positive airway pressure.
So his CPAP really changed his life. Of course, he began to give a good night's sleep for the first time in years, and he cannot live without it, but it is a little bit cumbersome. But why don't you tell us how that works?
Well, CPAP is a very, very simple therapy, very well tolerated, very effective. The machine simply takes room air, there's no added oxygen, puts it under pressure, and then delivers that pressurized air via a mask or nasal pillows or some kind of an interface into the upper airway. The pressurized air then works like a splint to hold the airway open during sleep. So I'm sure your husband, his snoring was eliminated.
Totally gone.
His apnea
I got
was
a
gone.
better night's sleep for the first time in a long time.
And he was waking up how many times?
Well, I think they said 200, at least 200 or 300 times a night. I can't remember.
And that's typically completely eliminated with nasal CPAP. It's
completely eliminated. It just changed his life. And I was telling you before the show, doctor, that my husband's always had very low blood pressure, very healthy blood pressure, even a little bit low. And all of a sudden, he went to the doctor, his blood pressure was up. And I had been suspecting sleep apnea, and I said, I heard that this will drive your blood pressure up. And sure enough, after he started using CPAP, his blood pressure went back down to normal.
Sleep apnea is a major contributor to high blood pressure. There's no doubt about that. And if left untreated, it significantly increases one's risk of bad cardiovascular events, heart attacks, strokes.
So in the chicken and the egg syndrome, the apnea comes first and then the blood pressure, high blood pressure? Or do you see people with hypertension?
In some patients, the apnea can be the primary cause. If a person, however, already has hypertension for other reasons, the apnea can significantly worsen that.
Wow. Wow.
So
and so this CPAP machine, it's a miracle cure, and this is a big one because it does have water that you can
it has
humidity.
a heated humidifier so that the air coming in is warm and moist. Yes.
And I can just attest to the fact that it does not keep you awake. It's very quiet.
Very quiet.
Little swishing sound, and that's it.
Little white noise.
Wonderful. Now, could we talk just for a minute about restless leg syndrome again? Because how common is that? And not as common as this, right? As the
not
apnea?
As common as sleep apnea, probably not, no. But at the same time, very, very common. We see restless leg patients every day in the center.
And what kind of medication, or how can you help that?
Well, in some folks, restless legs can be associated with low blood iron levels. So one of the first things your doctor might want to do is check your iron level to see if there's anemia. If there is, they may try raising the iron levels. If that doesn't correct it, there are medications that can be very effective. Interestingly, there are medications, they're called dopamine agonists that are often used in the treatment of Parkinson's disease.
Really? Interesting. But they're not, are they harmful to your body, or?
Not typically. Like anything, your physician would have to have a complete history to make sure that it's safe.
But the lack of sleep is harmful to your health.
Absolutely.
That's the thing we need to really get across, that it is serious. That it's serious if you're not getting a good night's sleep. And
these are potentially life-threatening disorders. Yes. Sleep apnea certainly is.
Now, this is a major tool that you guys use. What other tools are available to work with apnea patients? Is this a first resort? Is this a last resort? Or is this sometimes not an option?
Well, CPAP tends to be an option for the very mildest case and the most severe case.
Okay.
So we sort of see it as a first line because, again, it tends to be effective in nearly every case of apnea. There are other treatments. There are surgical interventions for sleep apnea.
I was going to ask you about that because I've heard of those.
That involve opening up that posterior airspace, sometimes removing the uvula or the tonsils, that kind of thing.
What kind of success rate do you see with that?
We don't see the success certainly that we do with CPAP. Overall, the surgeries tend to have about a 50% chance of improving the apnea by 50%.
Oh my goodness.
Now that said, in a well-selected patient where most of the risk for apnea is coming from anatomical features of the airway, the outcomes can be much better.
But is that choice usually a voluntary one from the patient, or is that one that you would wind up, in some cases, recommending over the CPAP? In other words, is that normally the patient says, I just can't deal with this machine, let's try anything before the machine?
Well, when patients say they can't deal with the machine, that's a bit of a challenge to us because CPAP is a very effective, very well tolerated therapy. And so we would want to work with that patient to find out just what the obstacles were to their being able to use the device.
Like
and
you don't want to look like a sea
that.
monster?
We don't give up very easily.
Well, I think it's a matter of, people, they use it, they start seeing benefits. It's like anything
it's like,
else.
well, that's
You
it.
start rolling with it. But
It's very typical in the first meeting for the patient to say, I can't imagine ever sleeping with this. And then they come back in the first follow-up and say, I can't imagine ever being without this.
Exactly.
Because they feel so much better.
Now, do you have to sleep on your back when you sleep with this thing? I mean, if you roll over, does it pop off your face? Or
You can sleep in any position that you like. It doesn't restrict your movement or your position at all.
Yeah,
And do you find sometimes that patients just need to work with different masks and apparatus? You got to mess with it sometimes to get it just right for that patient?
Absolutely. There's a lot of fine-tuning that goes into this therapy in terms of the mask fitting or the type of mask. I think last count there are 80 or 90 different CPAP interfaces out there, just finding the right fit. But once that's done, the therapy is very, very effective.
It's a miracle cure, it really is. I want us to get to some practical help for people who, for instance, I don't know, maybe have a hard time falling asleep. You had mentioned something that you just give people advice, like for instance, you give them instructions, like for instance, if they're laying in bed and they're wide awake, what do you tell them to do? Can you give our viewers just a few tips
Sure.
on what they can do to help?
Well, certainly laying in bed with your mind racing and being frustrated and trying very hard to fall asleep is a prescription for not being able to fall
Exactly. You
asleep.
try too hard. I
Absolutely.
do that. I try too
And
hard.
I think the more you try, the less likely it is to happen very often. So we tell patients with insomnia, if you go to bed and 20 minutes go by and you're not asleep, we want you out of the bedroom.
Wow.
What we're afraid of is that you're going to learn an association between being in bed and being awake. And that will continue the insomnia. So if you're not able to sleep or you wake up during the night, you're not able to return to sleep in a reasonable amount of time, we like to see you get out of the bedroom.
And how long do you stay up then?
Until you feel sleepy again, until you notice signs of sleepiness. Maybe you're watching television or reading and your eyelids are getting heavy or you're dozing off. That means it's time to go back to bed.
Okay.
How about, we talked
Advice.
about, obviously, most people not drinking caffeine, before. I know that I've been working out for many years, and my schedule was such that sometimes I used to work out after dinner. And I found that when I did that, I had a much harder time getting to sleep than working out first thing in the morning. Is that common?
Absolutely. I mean, there's a million reasons why we should all exercise, probably a little more than what we do. But exercise too close to bedtime, we think can be disruptive to sleep. When you're exercising, your heart rate is elevated, muscle tone is elevated, body
Adrenaline
temperature is elevated, absolutely. And those are all things that you need to turn down when it comes time to fall asleep.
What about certain foods? We know obviously not coffee, but are there other things that or should you eat at all in the evening?
We used to think that maybe tryptophan in warm milk or turkey could help us, and science didn't really bear that out for us. It's not a good idea to eat a great big meal right before you go to bed, but at the same time, it's not a good idea to go to bed hungry.
No, I can't handle that. It keeps me
Hunger
awake.
is very disruptive to sleep. So if you're hungry, have a snack, you'll be fine.